welcoming Dr. Sarah Moyer right now. As you all know by now, Dr. Moyer is the city's chief health strategist, also the director of our public health and wellness department. And Doc is going to run us through the updated COVID-19 data for Louisville. And we'll be emphasizing throughout this broadcast, the numbers continue to increase, and we need to take some corrective action here in our city to get the numbers going the other way so that we can reopen things to the extent that we want to. So it's all in our hands. So Dr. Moyer, why don't you take it away?
Thanks, Mayor. So as you mentioned, cases are on an upward trajectory in Louisville and across the state. So we are in orange this week, but it's getting really close to red again. We had 200 more cases than the week before, and we've lost about 10 Louisvillians a week for the last month. And remember that the last week data showing for the death is just prelim because it does take time for deaths to be reported to us. Our hospitalization and ICU numbers are holding steady, but we are starting to see an increase in cases again at our nursing homes, and so are expecting this number to change soon. We are quickly hiring to meet the needs of all these increased cases and now have 198 staff on board dedicated to calling COVID cases. They're reporting that majority of our cases are report contacts as household guests or family members, followed by workplace contacts. And so it takes all of us to break the chain of transmission of COVID-19. So please be vigilant about mask wearing, staying in well-ventilated places like outside and 6 feet apart, especially among friends and family and coworkers. Cases are tied to people, to individuals. So the virus doesn't move, people move. You have to be around other people for the virus to spread. If you look at one of our charts, the percentage of cases and deaths by age group, you can see that the most cases continue to be in our 15 to 30-year-olds. In a study CDC reported last week, young adults account for more than 20% of all confirmed cases in the U.S. Many of the cases in Louisville are in this younger age groups are attributed to activities outside of school, like sports, parties, living in congregate settings like dorms and large indoor gatherings. Locally, we've had multiple clusters, especially with volleyball teams and basketball teams, especially teams that play inside and practice indoors. But what's alarming is something we're seeing here and across the country is that younger adults and school-age kids are spreading it to those that are older and most at risk of severe illness and death. They might live with someone who's older, or their parent or family member might then work in a nursing home or in a place where they might then expose other people to the virus. We can do this, we can stop the spread, but it definitely requires all of us. So I challenge everyone to find the joy in this new normal of wearing masks, exercise, and enjoying the outdoors, enjoying restaurants outside instead of inside, enjoying your friends and family outside, maybe going on a camping or a hiking trip instead of vacations out of state. If we want to continue working or be able to send our kids back to school, this is our new normal. And so please wear a mask, wash your hands, stay outside as much as possible, and remember that the virus doesn't move, people move. So thanks, Mayor.